The most recent numbers from the Centers for Disease Control show Arizona has the third biggest decrease in life expectancy in the United States. And you can see how far we have dropped down from the national average. We've declined from our highest life expectancy ever, 79, down to 75. With modern technology and medicine, shouldn't that number go up, not down? 13 fact finders looked into the reasons.
Sakvi Satyapan takes his health seriously, works out every day, packs a lunch, gets plenty of rest.
But at the end of the day, I ask the question, like, what is my priority? Health.
Dr. Satyapan knows the recipe because he lives the research every day.
You look very stoic and serious.
Losing his father young in southern India led him to seek the keys to longer life at the U of A and Sarver Heart Center.
When you maintain your car, taking to the workshop, change the oil on time, change the tire, brake, it runs smoothly, right? Same thing like our body.
Moderate diet and exercise, mental health, and good sleep, those are the ingredients many Southern Arizonans are lacking. He says it's not so different from the India of his youth. Rising chronic disease, namely heart disease, diabetes, hypertension, on top of substance abuse and mental health issues are causing a breakdown.
Particularly in southern Arizona, or particularly in southern Tucson, there are a couple of factors that's mainly not been addressed yet.
Arizona counties with the highest life expectancy include Santa Cruz, Pinal, Yuma, Maricopa, and Greenlee. But when we zoom in on southern Arizona, we see more disparities.
But the gap is still there.
Zip code makes a difference. The average Foothills resident can expect to see 85, while the life expectancy for South Tucson is a shocking 16 years shorter. There's also a gender gap. In Arizona, life expectancy is 72 for men, 78 for women.
The decrease in life expectancy in Arizona was a lot bigger than any other state.
COVID-19. Arizona public health expert Will Humble says it delivered a 1-2 punch along with the opioid epidemic we just haven't recovered from.
When somebody in their 30s dies, it has a big impact on life expectancy statistically.
But then he says those reductions started before the pandemic.
Everyone for decades expected to be able to live longer than your parents did. And that changed pretty dramatically a few years ago.
Family does have a lot to do with it, and not just genetically. Humble and Satyapan agree income level is tied to life expectancy, not just because of access to care, but to healthy food, transportation, and opportunity, not to mention awareness.
Prevention is always better than the treatment. So they don't know what's happening for them inside their body, and so it's the last minute.
And often too late.
So what do we do about this problem? Dr. Satyapan prescribes action from both individuals and institutions, better preventive care and community education so people can make better choices and pass them on to their family. When I asked Humble about funding cuts for that, he said those in public health are very concerned.